I remember when I first got into a PhD program, I felt like that "This is public health" sticker was everywhere. But um, I think it's really a tool in a field that is dedicated to progressing equity forward and creating systemic structural transformation. I mean, ideally, that's what it is. It's um, that's what it's created for, in my opinion. It's about addressing the root causes of health disparities. And I think it's, the more, I mean, it might be like my bubble on LinkedIn, but the more that I'm on there and the more I mean, it's definitely my bubble, like, because the algorithm, when I think about it, feeds you what you want to see. But I feel like when I'm on LinkedIn, that it's clear to me that public health for me, in my viewpoint, in my bubble, in my world, is all about empowering marginalized communities. It's all about advocating for policies and practices, that promote health equity. So I think for me, that's what public health means to me. Like it's about improving the health of all, and the way you do that is by focusing on those that have been the most, the communities that have been the most dismantled and marginalized and oppressed.
I like the part about like public health also being a tool. I think that's a part that a lot of us kind of miss. But I think it is a tool and a perspective in viewing like the world and the work in a certain way. So appreciate that. Okay, so before you were Dr. Yanica Faustin, you began your journey and you got a Bachelor's of Arts in Biology and independent major in ethical genetics. Why did I not have the university? I do not have the university. Yes, so maybe you tell us the university and tell us about the thought process going into there.
Yeah, absolutely. So I went to Colby College, which is in Waterville, Maine. It's a small private liberal arts college. And, really my academic journey. So I ended up at Colby through a scholarship from the Posse Foundation. The Posse Foundation is a leadership scholarship. So they give out leadership scholarships to students. And at the time, I'm not going to date myself, but at the time they were much smaller. So they were in New York and a couple other places, and now they're like everywhere, like Puerto Rico, everywhere. And so I got this Posse scholarship, and I went to Colby. And while I was there, I've always been into science. Like I always knew I wanted to be a scientist, so I majored in biology. And I should also say, like, so I went from like Brooklyn to I'm from like the Prospect Lefferts Gardens neighborhood, if anybody knows where that is. So it's like near Grand Army Plaza, Prospect Park. Like that was the neighborhood that I grew up in. Then I went to Maine, Waterville, Maine, and not even Portland, Waterville. So it was very different from where I grew up, and it was kind of my first time leaving. It was my first time leaving New York City, really for a long period of time, and I knew when I was sitting in my biology classes, as I was like learning, that I was desiring a way to question what I was learning, if that makes sense. And so that's when I started thinking through philosophy. Like I took a philosophy class to meet, the liberal arts colleges, so I was meeting another requirement, and then I was really intrigued by it. And I thought, what if I made an independent major that kind of tied in? I was taking a lot of advanced genetics and genomics classes because at the time I wanted to be a genetics counselor. A genetic counselor. I didn't know what I never heard of public health, as most people at that time did not know about public health in their undergraduate studies. And so I was like, okay, I know I want to be a geneticist. I'm taking all these advanced genetics and genomics classes. I really want to couple that with philosophy and take a lot of like ethics courses. So I created this independent major that tied in both of them and called it ethical genetics. And that was really kind of that intentionality with creating interdisciplinary major. And then I also double majored, and then I also had a regular biology major as well. That really allowed me to like bridge that gap between like the biological science and then the moral and social implications of genetic research is what I was focusing on, but really science research in general. And I think like in a lot of ways, without knowing about public health, that was like the beginning of this interdisciplinary approach to, just thinking through why we're doing things the way we're doing them and how we justify doing things the way we're doing them. And like, especially with a long standing field like biology, which has a lot of ties to problematic, methods and people. Right. So I think it was a really, really strong beginning to shaping like this interdisciplinary, multifaceted experience that would later end up leading me to public health.
So I'm imagining that the scientist that you were envisioning maybe at that time was more a lab scientist, or am I envisioning that? Yeah.
Yeah, I even had a work study job for 3 years at Colby where I worked in a genomics lab. Yeah.
Okay.
Hmm.
So I'm looking forward to seeing that like transition and that thought process, and maybe even just like how did you learn more about public health? Because like I could imagine looking back on it and thinking about okay, moral and social implications of genetic counseling and how that could relate to public health. But maybe in that specific time when you were doing it, it wasn't something that was like standing out to you in that sense. But I guess we'll get to that in a little bit. While you were in your bachelor's program, you had a few different roles. I will list them out, and then you can go through them as extensively or least extensively as you'd like. So you were a cabin counselor and unit leader at the Hole in the Woods camp at Double H Ranch. You were a research genetic counseling intern at Children's Hospital of Boston
Yes.
genomics program, and a research assistant and clerk at Colby Fund office.
Yes. I was all of those things. I haven't thought about them in a very long time. Yeah, I think so. The Double H Ranch, amazing place. That's actually where I met my now wife in 2007. And it's a camp for kids with life-threatening illnesses. So as you can imagine, I went there because, so they're also a career partner with the Posse Foundation. So I found out about them through the scholarship that I had at Colby, and then I decided to go there because I wanted to be a genetic counselor, and they had a lot of kids with like rare genetic disorders and also very common ones like sickle cell, muscular dystrophy, also kids with HIV, spina bifida, all types of different conditions. And I learned a lot in that setting. I actually ended up working there for full time for 3 summers. If that's right. I think so. Yeah, I think I did counselor 2 years, then unit leader 4 summers. 4 summers. So clearly I loved it. It was a very hard job, long, working really hard. A beautiful place though, because they make it so that kids who typically throughout the year don't get to maybe go to PE class or experience certain things get to go to camp and just be a kid, because there's a medical team, and then we're trained on how to handle different issues with conditions, and they get to go to an amusement park, and we're trained on how to do lifts and how to watch out for different signs of someone going to sickle cell crisis, for instance. And so you get a lot of like some medical clinical training, lift training, and then in general you just learn to work on a team with people who are different from you for a really good cause. So I guess kind of a microcosm of public health in itself. Yeah.
And how about the other roles as research genetic counseling
Yeah.
and research assistant?
So I really, the genetic counseling internship at Children's Hospital of Boston was really amazing. I think especially at that time, like again, at that time I was in like my prime, I'm going to be a genetic counselor, like mindset. I've always been a very like planner. So that was like, I remember I had that on my plan from like freshman year. Like I will work at Children's Hospital of Boston because they had a wonderful genomics program. And I remember I was really excited because I got to work with Lou Kunkel, who was one of the people who discovered the dystrophin gene. I'm going to nerd myself out now. So I was really into genetics. So I was like really excited that I got to meet him and work with him. And what was really amazing about that position actually is that I had an amazing boss. I'm like completely blanking on her name now, but she really she just really for some reason really liked me, and very much like invested in what I wanted. And so she really allowed me to have all the shadowing experiences that I wanted. Like, so I would shadow not just her, but like a bunch of other types of genetic counselors to get a feel for the field, to decide what I wanted to do. And that was actually when I left that internship, I decided I didn't want to go into prenatal genetic counseling like I thought I did, because it was really sad to sit there and watch the prenatal counselor tell a pregnant mother that that they just discovered what their child had, and just watch that was like, I was like, oh no, I can't do that. This is too difficult. And so I was like, okay, I know I want to work with kids, so I'll be a pediatric genetic counselor where, you already have a child who has a condition and you come in and you're trying to learn about gene therapy or learn about more things about the condition. So I guess it taught me that, clinical settings might not be my strongest place because of the emotional toll of it all. So that was one thing I learned from there. And I had a really great supervisor who really taught me that I can ask for the experiences that I want to shape the career that I want. And I learned a lot about ethics there too, like sitting in on the conversations the doctors were having during like grand rounds and things like that. The geneticist was really interesting too. So I incorporated a lot of that. I remember in my final project for my senior thesis. Then the Colby Fund, I worked at the Colby Fund all 4 years when I was at Colby, and it was kind of like my second home while I was on campus, and it was filled with some amazing people who really showed up in a lot of ways for me while I was there. So I'm really grateful to the Colby Fund. And I learned a lot there about philanthropy, and the importance of giving back to a place that has shaped you, and not just academically, but as a person. And actually, it was like the chair of Colby Fund giving for my senior class, and we ended up breaking the record for having the highest participation. Shout out to Colby class of 2010. And yeah, it was like one of my largest leading roles while I was on campus. I did a lot of leadership while I was at Colby. That's kind of the premise of the Posse Foundation. Is part of it is that you're going to be a leader on campus as well. And so I was in a lot of leadership roles while I was there, and Colby Fund, my senior year was one of them.